won't have to worry about receiving a surprise bill in the mail, because we'll limit the amount your insurance company can force you to pay out of your own pocket. You won't have to worry about pre-existing conditions, because never again will anyone in America be denied coverage because of previous illness or injury. Or leave your job, because every American who needs insurance will have access to affordable plans through a health insurance exchange, a marketplace where insurance companies will compete to cover you, not to deny you coverage. And if you run a small business and you're looking to provide insurance for your employees, you'll be able to choose a plan through this exchange as well. I've heard from small business owners across America trying to do the right thing, but year after year, premiums rise higher and choices grow more limited. And that's certainly true right here in Ohio. Now, if you're a taxpayer concerned about deficits, I want you to understand I'm concerned about deficits too. Because in the 8 years before we came into office, Washington enacted 2 large tax cuts, primarily for the wealthiest Americans, added a prescription drug benefit to Medicare, funded 2 wars, all without paying for it. Didn't pay for it. The national debt doubled. We were handed a $1.3 trillion deficit when we walked in the door. One we necessarily had to add to in the short term to deal with this financial crisis. Now, I have to tell you, I have to say that folks have a lot of nerve who helped us get us into this fiscal hole and then start going around trying to that people don't have a little more shame about having created a mess and then try to point fingers, but that's another topic. Because the truth is that I am now president. Together, we have to restore a sense of responsibility in Washington. We have to do what businesses and families do. We've got to cut out the things we don't need to pay for the things we do. And that's why I pledged that I will not sign health insurance reform. As badly as I think it's necessary, I won't sign it if that reform adds even one dime to our deficit over the next decade. And I mean what I say. Have estimated that 2/3 of the cost of reform to bring health care security to every American can actually be paid for by reallocating money that's already in the system, but it's being wasted in federal health care programs. So let me repeat what I just said. About 2/3 of health care reform can be paid for not with new revenues, not with tax hikes, not just with taking money that's not being spent wisely and moving it into things that will actually make people healthier. And that includes, by the way, right now we spend more than $100 billion in unwarranted subsidies that go to insurance companies as part of Medicare. Subsidies that do nothing to improve care for our seniors. We ought to take that money and use it to actually treat people and cover people, not to line the pockets of insurers. And I'm pleased that Congress has already embraced these proposals. And while they're currently working through proposals to finance the remaining costs, I continue to insist that health care reform not be paid for on the backs of middle-class families. In addition to making sure that this plan doesn't add to the deficit in the short term, the bill I signed must also slow the growth of healthcare costs while improving care in the long run. I just came from the Cleveland Clinic, where I toured the cardiac surgery unit, met some of the doctors who are achieving incredible results for their patients. And there's important work being done there, as well as at the university hospitals and Metro Health. Cleveland Clinic has one of the best health information technology systems in the country. And that means they can track patients and their progress. It means that they can see what treatments work and what treatments are unnecessary. It means they can provide better care for patients. They don't have to duplicate test after test because it's all online. They can help patients manage chronic diseases like diabetes and high blood pressure and asthma and emphysema by coordinating with doctors and nurses both in the hospital and in the community. And here's the remarkable thing. They actually have some of the lowest costs for the best care. That's the interesting thing about our healthcare system. Often, the better care produces lower, not higher expenses. Because better care leads to fewer errors that cost money and lives. You or your doctor don't have to fill out the same form a dozen times. Medical professionals are free to treat people, not just illnesses. And patients are provided preventive care earlier, like mammograms and physicals, to avert more expensive and invasive treatment later. That's why our proposals include a variety of reforms that would save both money and improve care. And why the nation's largest organizations representing doctors and nurses have embraced our plan. Our proposals would change incentives so that doctors and nurses finally are free to give patients the best care, not just the most expensive care. And we also want to create an independent group of doctors and medical experts who are empowered to eliminate waste and inefficiency in Medicare. A proposal that could save even more money. So overall, our proposals will improve the quality of care for our seniors, save them thousands of dollars on prescription drugs, and that, by the way, is why AARP has endorsed our reform efforts as well.